Welcome to the Langford Academy. In the previous video we talked all about why you would do skin sampling, and in this video we're going to show you how to take those samples. So now we're ready to take our hair pluck. The first thing we're going to do is put some paraffin on the slide. It doesn't need to be a lot, it just means the hair's going to stick to it better. Okay, so now we've popped the paraffin on the slide, we're going to take our forceps. We're going to approach an area of interest. Obviously Farley doesn't have any actual skin disease, so we're going to just take an area. We're going to go in with our forceps and gently grasp a small amount of hair, a small tug, and as you can see she doesn't feel it or react, and then we're going to place it on the slide. So we've taken our sample, we're now going to place the hair onto the paraffin. And ideally we want all the hairs in the same direction or as close as you can get. Okay, so now I'm going to put my slide on the microscope ready for assessment. Okay, so now we're going to take our sellotape sample. Obviously Farley doesn't have any skin lesions, so we're just going to find an area to demonstrate sampling. We're going to part the hair because it's the skin we want to sample. We're going to gently take our sellotape, we're going to press the middle against the skin nice and firmly, and then that's it, we've taken our sample and it's ready for staining. So now we're going to prepare our skin scrape sample. The first thing we're going to do is take our liquid paraffin and we're going to put a little bit on the slide and on the blade. So just a small amount. And then this is a number 10 scalpel blade. I tend to also just put a little bit on the blade as well for ease. And we're ready to take our sample. Okay, so now we're going to demonstrate taking our skin sample. Because Farley doesn't have any skin lesions and because she's a very kind demo dog, we're not actually going to scrape her skin, but I'm going to show you how we do it. We've already prepared our 10 blade with a little bit of paraffin. We're going to gently part the hair, and this would be in an area where there are skin lesions already. And then what we would do, and what we're going to very gently do with Farley, is run the blade in the direction of the hair. You would squeeze the skin first. This is so if there's any mites, you're squeezing them up to the surface. And then you would just gently run the blade in the direction of the skin, and you do that until you get capillary ooze, so until there's a little graze, a little bleed. Obviously we're not going to do that to Farley now. And then we're ready to transfer that onto our slide. So obviously we don't actually have any material on this blade because we haven't genuinely scraped Farley, but what we would do is gently transfer the material from the blade onto the slide that we prepared earlier. So we're just going to wipe it gently onto the slide because we want a nice thin kind of film of material. And then we're ready to go and look at it under the microscope. So now we're going to take an impression smear. Obviously Farley doesn't have any skin lesions, but the kind of lesion you'd be sampling like this is a really moist, wet, ulcerative lesion. So what we're going to do is find affected skin, and then we're just going to gently press the slide onto it. Obviously it would be moist, there would be sample, and then we'd stain it and look at it. Okay, so now the slides are ready for staining, and it's exactly the same whichever technique you've used, so I'm just going to show you once. So first into the fixative, minimum of 5 dunks. And then into the red stain. And then into the blue stain finally, again a minimum of 5 dunks. And then we're ready to rinse our slide. Now we're just going to rinse the back of the slide. And then we just need to dry the slide before we look at it. And then using a bit of paper towel, I just fold it over backwards like so. We're going to dry the back of our slide and the edges. The top is fine to be wet and still looked at. And now that's ready to look at under the microscope. And now we're just going to look at our slide under the microscope.